For centuries, Western medicine has treated menopause like a disease, a hormone deficiency to be corrected, a breakdown to be managed. We have been conditioned to believe that this transition means inevitable decline, discomfort, and diminished vitality. What if there was another perspective that could help us rewrite this narrative? Halfway across the world, an ancient medical tradition has been honoring women's midlife transitions as sacred, believe it or not the end of vitality, but the beginning of our wisdom years. Today, my guest, Dr. Christopher Motley, he's an expert in traditional Chinese medicine. He's going to take us deep into the world of traditional Chinese medicine, where your symptoms aren't necessarily problems to be silenced, and where the second half of our lives isn't about managing decline, but rather about claiming our new power. Doesn't that sound great? He's going to help us understand how Eastern approaches to women's health and aging differ from Western paradigms, and what we might gain by integrating this new perspective. Thank you so much for being here, Dr. Chris Motley. I'm loving your podcast. If you don't know what it is, it's the Ancient Health Podcast. So good. Thank you for being here. I'm so excited for this perspective.
Thank you for having me. And I'm just so glad we got to connect, and so thankful for the people we know mutually that got us connected. And this is like a good friendship, because I can tell, I love the way you operate and love how you see health, and you treat people so bio-individual. So yes, I'm really happy to be here, and I'm loving to talk about anything with hormones and Chinese medicine.
No, you know what's funny? So when I was first going to interview you, I really wanted to. I'm like, I want to hear this perspective. I want to learn from him, but I had this bias coming up. So I'm just going to say it. I'm like, he's a dude. He's not a midlife woman. So how is he going to help us here? And I'm sure you get this sometimes. I just wanted to lean into the uncomfortable thing first.
Yeah,
and
totally.
Because I know you have a lot of women clients. Tell me what comes up around that, because they are dealing with this.
Truly, and that's a very valid, true statement, and I totally respect that. I think I come from the angle, for everybody listening, that I do have worked with individuals, with ladies that have their hormonal tests come to me, but I always first say, I don't know exactly how you feel, but I thought over the years that I've gotten good at finding which organ patterns and toxicities, like you and I talked about on the podcast, about any infections and microbes. So the one thing that I think over the years to help a lady is that now more are coming to me over the years, because I help clean out their gut and clean out the infections in certain organs, because those organs can then correlate to the ovaries and cause some issues with the ovaries and the uterus. That's how I feel like I've been really effective. And so I don't want to act like I know everything about how a lady feels. I really am not that way, but I'm thankful. Over the years, I've had majority of my pages, about 80% of them are ladies, and it's really because, and you said this before, it's like whenever you feel a certain way and you feel disconnected, there are times when they've gone to the regular Western medicine route. No knock on Western medicine, I'm just saying they've gone that route, and they're like, I've got to have some different view. So the only reason people came to me is because they wanted a different view, and I'm thankful for that, because they're just like, I don't know what really you do, but my friend said that you did some stuff with parasites and stuff, and it helped her cycle get regulated, and I'm like, granted, let's go. Let's do this. Okay, that's me.
Okay, so I want to lean into this. So TCM, traditional Chinese medicine, that's what it stands for, right? That's okay.
Yes.
What is that exactly? What is the belief set around that? What's the approach there?
Now, there are a lot of facets of TCM. So without getting too boring, you're going to see people that can go through acupuncture, moxibustion, where they burn this moxa. You see it's like almost using scent therapy. You have cupping. You ever seen cupping? Herbals, acupressure, gua sha massage. These are all parts of traditional Chinese medicine. So when you see that, they've put them together. The premise is that you and I all have electrical wiring in our muscles and fascia, and that electricity is traveling through specific wiring, not the nerves, but there's specific pathways that are 12 on each side.
Okay.
One in the front, one in the back. So I wish I had my medicine doll, my Chinese medicine doll. But that these pathways literally are sending electricity around the highway on your body, and that electrical highway is stopping off at certain stops on the highway to give energy to certain organs. I hope that makes sense. So it's going down the gallbladder meridian, it jumps off into the gallbladder, gives it energy, and then the gallbladder is like, thank you very much, I appreciate that. And then the energy and it passes right through the gallbladder and goes down the highway, and it'll go into the liver. So that's how your body gives energy, electricity, chi, to the organ. So Chinese medicine would say, what if there's a block in the highway? What if there's a block
Oh,
in the electrical highway? That means if there was a block right after the gallbladder, like let the
okay.
gallbladder so sick. What if somebody had a sick gallbladder? The chi goes to the gallbladder, it's nurturing it, trying to heal it. And then the liver says, hey, I'm down the wire. I need the energy. But the gallbladder says, hey, I'm really sick. I can't
Mm-hmm.
let go of this energy because there's emotions involved and it won't allow the chi to roll down to the liver. So the liver gets sick, it gets deficient. Gallbladder gets overexcited, liver gets deficient. Now, the function of the organs then show up on your blood test. So
Okay.
what I'm doing is Chinese medicine would say, find the blocks, release the blocks, allow the energy to flow through all the organ systems. And here's a really cool factor. Not only do the organs help each other flourish and get stronger in this cyclical circadian rhythm in your body, but they
Mm-hmm.
also have a thing called a co-cycle. And people say, what is a co-cycle? Co-cycle means destructive cycle. So there's a building of chi, and there's
Okay.
also a chi pattern in every one of us, you and I, that organs keep an eye on each other. They're called, basically, it's like a big brother, little brother, big sister, little sister. Like you're getting ahead of yourself. Don't overdo it. So have you ever heard of Chinese elements? Elements.
Yes, but I don't really understand it. So
That's
help us with that.
exactly, it's like that. I hope this is not too boring, but
Okay.
this is what
No, this
happens.
is good.
So you have the elements, and this is where the co-cycle comes in. You have the fire, right? You have
Uh-huh.
earth, metal, water, wood. You have five
Okay.
elements. But think about the names. Like let's say metal, which is represented by the axe. If you have someone who's a very strong metal quality and they're very edgy and they're very sharp, they would cut into a wood element, like myself.
Okay.
Okay? So the organs, I'm saying like the organs of the metal element are the lungs and the large intestine. If they're overabundant and they're sick, they will pick on the wood element organs. I know that's a lot to take in. So I'm saying
It is a lot to take in, but I'm intrigued. So,
it is
so, uh,
intriguing.
so, okay. So
But
wait, I want to back up a minute here. So, okay. So this is bigger than obviously menopause and what's going on. This is like our whole life. It's
it's
a
all like
different approach.
it
So
is.
when someone is not feeling well in any area, I don't want to oversimplify here, but I might
I love
try
it when you
to here.
oversimplify it.
Okay.
Do it, do it, do it.
So, like traditional Western medicine, you have a symptom, something's wrong, and they go, let's stop the symptom and fix it. Another level of Western medicine would be what's causing it to be wrong. But you're going like many steps back and saying, wait a minute, there's a blockage that created this to manifest that way. Am I
That's
saying that correctly?
exactly right. That's the way you simplify it. We go back and what we're trying to do is find the point of the blockage, and
Okay.
then we identify the organ that's associated with that blockage. And if you heal that organ and get rid of that blockage, everything downstream starts to fall in place. It gets balanced.
Okay, so like I just want to like throw out a few examples, and I'm going to start with maybe one that I've experienced. So let's take back pain. Like you
Yeah.
have lower back pain, and somebody goes to an orthopedic surgeon, and they're like, "You have a disc bulge, you need a surgery." So that's one approach, right? Or they
Mhm.
go to their general practitioner, and they say, "You have inflammation, you need an SADs, like to
Yep.
stop the inflammation, right?" Or you go to the physical therapist, and they're saying, "Well, wait, you have this problem, so let's fix the exercises." But they go to the acupuncturist, they go to you, and you say, we're going to put some needles in these areas to undo the blockage that's causing that. I know I'm like really
No, it
basic.
truly, and the good thing is that as seriously, my office too, I'm like, no, go do those things and go check and make sure
Mm-hmm.
all these parts are listed. What I would do for people listening, first thing with low back pain is I would always check the meridian pathways, the little electrical pathways that are running through
Okay.
the low back, which would be the bladder. And there's cross ones that have to do with the colon. So the first two
Okay.
things I would do is check that person's energy in their bladder and in their colon.
And how do you check the energy in those areas?
We do pulse points analysis where we get very sensitive to where we put our fingers on the pulses and on the wrist. We check the tongue, we check the eyes, we check basically the hands, and the structure and the color of the hands, tongues, and eyes will tell you which organ usually is off. I do frequency
Whoa.
medicine too, where I do biofeedback devices that allows me to find out how much electricity they have these little devices, how much electricity is running through that wire. So basically, I have a little device, I put it on the bladder meridian point, which is one of their master points, and
Okay.
it'll tell me how much voltage is running through that wiring. So it would tell me, let's say you went, Natalie said,
Yeah.
well, I've got a UTI. I know I have a UTI, but they
Uh-huh.
keep telling me I have no E. coli. I'm like, and then they come to me and I check it and I'm like, that meridian is super low. It is drained. I'm telling you, there's a bacterial infection in and they're not going to check for anything else but just E. coli,
Right.
right? So then I check history. We check if there's been any bladder infection in the past. Guarantee there has. We clear that up, and I'm telling you, back pain can go away. Literally, I've seen people with
Whoa.
really bad disc bulges
Okay.
fixing their bladder and also their colon in the same way because the nerve, this is how neurology comes in. The nerve, guys, from the colon or from the bladder, they share nerve roots. They literally go into the spine. Where at? L5 and S1. So when you see a bulged disc, I know the orthopedics like, let's have surgery. But in
Yep.
my world, I'm like, no, the nerve that goes into that disc is going out to the bladder and to the large intestine. And they could have infections and yeast and mold and viruses and parasites. And they're overstimulating that organ, sending a really bad signal back to the disc. And the disc is super inflamed. And you're always going to say, well, my low back keeps coming out. I've done all the exercises, but it keeps slipping out because there's a sick organ behind it. That's where Chinese medicine
Whoa.
comes into play. I know it's a lot to take in, guys, but it's not, go to these other practitioners.
Yeah.
It's valid. You need to do it. But we're trying to find the blockages and then find why the blockages are occurring in the qi. That's the goal of Chinese medicine.
Okay. So
That's a lot. Sorry,
no,
Natalie.
no,
Okay.
it's good. I'm trying to follow here. So it's not do this instead of, it sounds complementary. So like you're saying, like you want to do the exercises, you want to get inflammation down, you want to do that, but we've got to figure out root cause. So how does that work? Like if you actually, let's just say you have, and I know we're on back pain now, and we're talking about menopause. We're going to get to that too, I promise. But you take, so you actually have a, like, and that's actually me, L5S1. Like I had a ruptured disc there. So that's real. So the structural thing can be real, but you're saying in addition to the structural thing being real, how you feel it's related to that. I want to understand the correlation
That
there.
is completely valid. That's completely right. It's because you had a blown disc. You have to go get PT. You have to probably maybe get surgery. You have to do certain therapies and exercises. What I
So
would
that's
say,
factual, but then you're saying,
now,
okay,
like the other part would be like I would check for you. I would say, okay, first of all, in that area, I'd probably go to bladder, ovaries, urinary tract system, those areas,
okay.
and do a lot of analysis. The backdrop would be, Natalie, I don't want to get overcomplicated, but when you find out that organ is not working 100% and it's inflaming the disc, your disc will keep getting inflamed even after you get all the PT
Makes
and after all
sense.
the things because it just keeps stimulating. And then I, as a practitioner, what I would do is I would look into the emotions of the bladder and the kidney. I would say, was
Okay.
there a trauma in your life that you had high amounts of fear and ever feeling like you're stuck in life, I can't move forward? That's a huge emotion of the kidneys and the bladder. And that's the bladder going into the low back.
Okay.
So that's stimulating your low back to have pain. That's what I would first suspect.
Okay, wait, this is wild here. So this, you just brought in another component. There's a whole nother train of thought. I didn't even know we were going to go here, but we're going to go here now. There's a whole nother train of thought when it comes to pain, especially back pain, about emotions. Is that what they're referring to? Or are those different too?
No, no, totally. I love it how you show on your podcast. We're saying everything's complementary, but the back pain, which you do in Chinese medicine, is if you have pain in a particular area of the back, okay?
Mm-hmm.
So down the spine, oh, it's my mid back, around my kidneys, where
Okay.
your pain is. You then relate it to the acupuncture points that line the spine. You
Okay.
find it like tic-tac-toe, you just go, pop. Okay, what's that point? That one's related to an organ. So and then I would say, oh, let's say it's your spleen. Somebody has a swollen spleen or mono when they're a kid. Then the emotion with the spleen is what? Worry, pensive. Do you worry, over worry? Do you get over concerned?
Mm,
And that will inflame that T7 disc, that mid-back disc. They're like, that always hurts. My chiropractor always has to pop it. My physical therapist always says,
yep.
lats are always weak. When I do a lat pull down, I can't pull down. My triceps are always weak from the spleen. And that's what I love to do. Then I go into their emotions, and some people will say, and they say it to you too, they go,
Mm-hmm.
did you know that about my emotions like that? And I said, I'm not a rocket scientist. I just know how to press points and know where to go on the acupuncture system.
So when you're when you're doing the points, acupressure or acupuncture, first of all, is there a difference with that? Like, does it different levels? And like,
Yeah.
what's the difference there? Acupressure and acupuncture. And then what is that actually doing? Like, how is that fixing it?
Okay, so you are so good at asking questions because I got to try and make this as simple as possible. Because I'll start talking and getting rattled, and people are like, Christy, the producer, she's like, okay, buddy, you need to settle it down. Okay. So when acupressure, there's arguments. Acupressure, never underestimate whoever's listening that you can use your hand, your finger, or pressure to open up the blockage within the muscle or the fascia, the connective tissue.
Okay.
So I hope this is a visual. Everybody thinking
Yep.
about this. You have these little wiring going through your muscles, like in certain like down these little highways. I'll send you a picture of the Chinese medicine chart. Maybe they could put it up. But I'm saying you can use pressure, your own hand digital pressure to open up the fascia. Like there's like the trigger spot. No, that's an
Yeah.
acupuncture point. Okay, that's good. There's arguments that some acupuncturists say, no, you need to use a steel needle. Yeah, I need to use a gold needle. I need to use a silver. They say silver sedates. All these arguments. Some people use laser acupuncture. Do they all work? Yes, I think they all do. Is one better than the other? Some would argue, but you and I are the same way. I'm like, they can, but I've found really good. I've used them all, and I think they can all work if you use them in the right
Okay.
way. But this is the difference. It all depends on the angle or the vector, like the angle like an antenna on a TV, It
Yep.
depends on what angle you press into that point. That's the key.
The
Like rabbit
angle.
ear antennas. Remember when we were kids? This is how
Yep.
when I was a kid. I
Yep.
used
You
to
got to
get
get
up
the
there and get the
perfect
picture.
angle.
If you put the right angle, the body will use that to unblock the point. That's what they do. So what I'm trying, the whole point premise is you use the right angle for a practitioner,
Hmm.
press around your, if you want to use self acupressure, but the whole goal is to open up the fascia so the chi, the electricity runs right down the highway. That's all it is. I'm just trying to unblock the system. That's all it is.
So this brings me to, if this is done wrong, it can actually be harmful. So if you're just going to go to some like little I'm just like the mom and pop like reflexology stop, and they're like, we're doing reflexology to open up your chi. If they're not doing this at the correct angle, could that be harmful?
It possibly could. And I know not anybody does reflexology, but I know you
Hmm.
like exactly if you, and this is another thing, if they do at the right angle, the wrong vector, and they torque, I hope that's the right word, torque the fascia in the wrong way. Like literally if
Yeah.
you press and they're trying to open, but they twist it, that can affect the way the meridian flows. So you have to be very careful the practitioner you go to because you know like when people come to us they're like I love deep tissue, I love getting somebody getting kneading in there. I said reflexology is the same way, but the issue we have to be careful of with reflexology and any practitioner,
Yeah.
acupuncture included, is that if you overwork the point and the fascia, you can create little torques and twists, and that can sometimes, if you're not monitoring the system correctly, it'll allow too much energy to flow through, and you don't want that. Like it'll make you feel
No.
sick, like you feel like you gotta throw up, you feel like, oh, I gotta go diarrhea. So always find, I truly mean this, find a good practitioner that you trust and knows your body really well, that is willing to investigate. Yeah.
Okay, that makes sense. Hey there, if you're finding value in this episode of Midlife Conversations, I would really appreciate it if you would hit that like button and subscribe. And when that little bell pops up, you want to hit that. That way you are notified of all new episodes so you don't miss a beat. Also, you subscribing and liking helps others find this content. And this allows me to keep growing, keep getting amazing new guests for you, and to keep sharing. Okay, so this is interesting about the emotional thing too. So when you're saying that emotions, I want to understand this because I hear that a lot, like emotions are affecting things. In Chinese medicine, when you say emotions are affecting things, is it as simple as opening it up through these pressure points, or do you suggest additional work? And like, how does that work? Is this like,
Great question. Yeah, I'm with you because I know we talked about mindset and about belief systems, and I am 100% on board with you. You have to create a new neurology, a
okay,
program, and I always associate it like an old iPhone. This is my horrible analogy, Natalie, so don't get mad at me, okay? But I always say that if I had my phone and
uh-huh,
for some reason I had a program belief that's an old app that's running in the background, it's going to keep pulling my battery, and
right,
because I didn't swipe it off. Okay.
yep,
So I'm with you. You need to create a new momentum. So you'd have to swipe the old one off. I do believe that acupuncture and techniques that are emotional based techniques that use acupuncture can help you swipe them off, can help you swipe them off. But you yourself, like you said, you have to create the new program. You have to create a new, like, I'm going to do this in my life. I'm going to go this far. But I'm saying that acupuncture helps you swipe off the old program. It'll actually do this. This is cool. Hope I can explain this really well. So let's say for me personally, if I have, and I've had bladder issues,
mhm,
and because my dad had them.
okay,
And that would tell me through the acupuncture system that there is a fear that I will not get ahead. I do not like to stay stagnant, like urine in the bladder. You don't want to stay stagnant. So it's
right,
happened psychologically and physically. And so you start noticing, well, I'm getting up more in the middle of the night to go pee, right?
okay,
Now I use acupuncture and acupressure to fix those bladder meridians. I stop urinating as much, probably like down to one
mhm,
time a night. I'm pretty impressed. I mean, sometimes I actually get impressed with it. I'm like, wow, that stuff does work. I've been doing it for 20 years,
yeah.
right? But the other thing is, I will start having dreams of fearful trauma issues in my brain, and I do not know why it happens. But the beautiful thing is, I notice that I'm not as jumpy or anxious. So it does allow that organ to nurture, to heal, and that will help ease the emotion. It will help it release so you can actually get rid of the emotion.
Oh, that's cool. Okay. Now, I've never understood this. I just knew when I've done acupuncture, not that many times. I've done it a few times over my years. And I noticed I would feel better after, but I never understood why. So now you're helping me understand why. This is cool. I never put this together.
It's real okay for if it's going to be really I want to make it so simple. It's just like going to your wall switch and you flip the switch on and all you're doing is connecting a breaker, like you're just allowing the electricity to flow through. That's all you're doing. You're just flipping the switches on. That's what we're trying to do.
Okay.
Everything works together, like synergistically. I can keep going on emotions, but I know
Yeah. No,
I don't
this
want to
is
take anything
good.
away from it. Yeah.
Okay, I'm going to shift it a little bit. We might come back to that, but I want to understand menopause from the perspective of Eastern medicine. Like, how do
Ooh.
they, and I know this is a really big question here, but this is important. And the reason I'm going to do this is my space being in menopause, right? And this is a lot of my audience is perimenopause, menopause, or postmenopause. And we get told two camps. Either deal with it, you're aging, like accept it, and then people are like feeling unheard, or it's like you do hormone replacement and that's your only answer. Like there's these two, and I know those are really black and white camps, but this is like these are two camps that I find women falling into. And I'm definitely a fan of HRT, so I'm not knocking that at all. I'm a huge fan of it, but there's got to be a middle ground. There's some people that choose not to do HRT. They can't do it for whatever reason. They can't, whatever reason. There's got to be a middle ground. And what gravitated me towards this question with you is it's my understanding that Eastern medicine views aging and menopause a little bit different than Western. So I want to
Yeah.
get your thoughts around that first. And then I want to get how you navigate this with women coming in, struggling with us.
It is. There is even some differing views in Chinese medicine, but they do view it differently, in my opinion, than the Western medicine world, where we're always trying to find every way to fight the system, if that's the way to put
Mm-hmm.
it. Like, I need to
Yeah.
make sure that I stay young. Chinese medicine it sounds pretty cliche. It's always to try to make sure every organ is balanced to its optimum efficiency during your age. So it's not necessarily like, how can I keep getting younger? It's like, how can I age gracefully? How can I
Great.
take the information and properly, distribute all the energy properly. So when patients come in and they go through menopause, trust me, I've had a lot of patients that have come through perimenopause, menopause, and they're having hot flashes. My first response, and everybody that's listening to them who've asked me this question, is what do you try to do? Do you try to stop them? What I have found is that whenever I have a patient with menopause, if I work on the organs that help clean out excess estrogens and help clean out any extra progesterone, their hot flashes will cease. So the aspect I come from is not to tell anybody don't do hormone replacement.
Yep.
My aspect is strengthen the liver and the kidneys so that you can flush any excess hormones out that are not needed. So that's how I come into play. Like, so that's what Chinese medicine progressively would be. We're not, because sometimes we get this, there's a realm where they think that if we're alternative medicine, that like we're never going to tell anybody to go get hormone replacement therapy. And I'm like, no.
Right.
There's some individuals. This is not sounding harsh to those who have to do it. There are certain cells in the body that may have been injured, that may have had trauma, that may have aged to a point, or doesn't have enough chi to actually produce the hormones efficiently and remove them, and that's
Mm-hmm.
understandable. So you may have outside help, and that's okay. My theory and what I've seen in my practice is, if I know a person needs more estrogen or E3, or if they needed more progesterone, I then find out what organs are really needed to help remove any of the excess waste that comes from it.
Okay.
And it works beautifully. That's why I'm saying, like, the middle ground is where East meets West. That's why I always say East
Yeah.
meets West. So there has to be a conglomerate. I always thought that'd be so cool. We have a midwife clinic right across the hall, and they do hormone therapy. And then I love it that they'll send people back and forth, and they're like, well, what organ can I help clean up? You can clean up to help this patient with their postpartum. And that's really encouraging to me, because I'll see the report and I'm like, this is what we need to do. We need to clean up their liver.
Okay.
That's where the middle ground needs to play. So when menopause comes, I don't see it as a bad thing. I just say it's the natural tendency. Now, if they're in early menopause, if they go early,
Yep.
I will say, I look at their blood report. I make sure they get their blood report. But 9 times out of 10, I would tell you this, that a person's had some injury up in the liver processing area, and there's a connection to the ovary. So there's usually ovary infections that's not been identified, maybe in the uterus, and there's also liver infections. And so usually they'll go early, because I've had patients, when we cleaned them out, they're already in menopause. I cannot tell you, Natalie, how many times I've done this, and they've
Wow.
gotten mad at me. They'd come in and go, I didn't have a period, and now I'm
Right.
starting again. Why? It's like, because they had so much yeast and parasites. And you know as well as I did, clean them out, the liver's like, oh, I can start doing what I'm supposed to do now. And that's happened a
Interesting.
lot. Yeah.
So one of the things that you're saying is that if you are early getting symptoms, so you're like kind of premature getting symptoms for perimenopause or menopause, this could be a big contributing factor that we could slow that progression down by opening this up, which makes sense. As you're explaining acupuncture, I'm thinking of like a kink toes.
Yeah.
And a kinked hose, the acupuncture would be unkinking it, really. Like that would be, but
That's a great
everything
analogy. I
else
didn't
would
use that.
be, oh, well, we'll just add a few more hoses. So now we got like 10 hoses that are kinked. So we're still getting the same amount of water, but it's operating slow at each of the thing.
That's
Or
great.
it'd be, or let's
Yes.
just cut it off and repair it. Like, so you're just saying, no, let's just unkink it and move things along. Is that,
That's exactly right. Because it's such a, I'm going to use that now. Don't be mad if I use that from
no,
now on.
I love
Like,
it. That's
seriously,
good.
like you unkink the hose because it truly what you're finding is the kinks in the hose. Like you and I talked about your belief systems, and I'm
Hmm.
not veering away from the hormones, but your belief systems or a trauma, they say in Chinese medicine, in the past could it create a program like an app
Hmm.
that's running, and you have to modify your physical body, your hormones, your biochemistry to handle the trauma. So that could, like, let's say, I don't want to say like they had sexual trauma or they had some kind of trauma
Hmm.
to their ovaries and they have a shift in their programming. And that when that shift happens, it creates many little blockages along the way because that belief system's telling the ovary you're injured. And so, does that make sense? So, all
Yeah.
these little kinks occur in the system, and all we have to do is not saying we can get rid of the trauma, but when we unkink, like you just said, it really is a matter of us trying to find out if there's emotional programs that are running in the organ. That's what, in my opinion, Chinese medicine is. And I'm not saying that everybody has hormones or perimenopause.
Yeah.
They should go out and try to find out their emotions. I'm just saying, and not saying it's all sexual trauma, not at all. I'm just saying that there's traumas that could be associated with organs, and it is the job of the practitioner to investigate, in my opinion.
Wow. Okay. So now what about the woman that is like they're actually it's on time, they're perimenopause or they're menopause. Like they have it's not because it's early happening, it's just normal part of life. This is like this is your time, this is what's happening and they're experiencing things. How is that looked at with acupuncture and what do you encourage there?
Okay, I always encourage if you go into menopause and you have night sweats, and I get it, we have night sweats, and some people have severe night sweats. I understand that. But I will say that a lot of my patients, thankfully, we've repaired certain organs to help them not have as much severe, and sometimes actually help them get through menopause without having severe flashes at all. And
Okay.
one of the biggest things is like if you're going through it and you know it's a natural, the biggest thing I would say is always check your thyroid. And I don't want to get too far into it, but the thyroid is part of what we call the fire element. It gives you a lot of
Hmm.
energy. And what I have found mostly in most individuals that have like a really bad, sweats, is that they're triple warmer. It's the thyroid, it's related to the thyroid and
Okay.
a lot of metabolic organs, is always deficient. And that's because the person usually has weak kidneys. So I know this is a lot to take in, but I will tell you, everybody's having like any normal, you have a normal,
So
but you're
you're saying if they have low thyroid, it's weak kidneys? Is that am I hearing you correctly? So
yeah,
okay.
if you're going through like a menopause and you're finding
Yep.
like it's on time, but I'm sweating a little bit more, I have a lot more night sweats than I want,
Yep.
please check your thyroid and make sure that those levels are optimum. Check for hidden kidney infections because the kidneys are the battery pack. They feed up into the fire element. They feed the heart. So I always say hidden kidney infections, UTIs.
Mm.
And
So
I
you
will
can
say
have, can you have hidden kidney and UTI? Like I always think of that, like kidney and UTI. I would imagine you'd end up in pain so how do you, but
not at
you're saying,
all. Yeah, I mean, I agree with you, but it's like literally most of the time when people has UTI, it's not just E. coli. There's strep, there's staph, there's certain form
interesting.
of yeast, and they won't check for it. There's a great lab, and shout out to them, is Microgen with a G, Microgen
Okay.
DX, and they check for like over 50,000 bacteria. And in fact, I've had patients that have had really severe hormone issues, and from my indications, I'm like, I think this person has a bladder infection that's not accentuating the thyroid, right? Helping them
Uh-huh.
through their menopause. And then we go get it sent off, and they'll have 6 different forms of strep. They went 3 times to the normal doc, and they said, no, there's no UTI. And then they come in and they go get one at this place, and it's like, oh, you have 6 forms of strep in your bladder because they don't test for them at the hospital.
No, and if they do have that, can you fix that or is that an
Oh, yeah.
antibiotic? Because like, and how do you do that without it being an antibiotic, which then creates other health problems?
Yeah, you can do an antibiotic if you want, but I love nature's antibiotic. I love golden thread. It's called Chinese coptis. So golden thread is
Okay.
amazing. And an
What is that?
golden
That's
thread is called Chinese coptis. It's a beautiful flowering plant, and it's what Chinese medicine they use is like almost it's nature's antibiotic. Basically,
okay.
it will kill viral, or it's shown to really handle viruses, yeast, mold, bacteria, parasites.
Can people just take that as like precautionary or you have
And
to have?
I've had patients that have taken that. Always talk with your primary care doctor if you have any
Okay.
questions. I'm all about that. But I've even had some that have taken it with their antibiotics because it's such a good cleanser. So, and some it's such a good laxative because it kills so much. I've had people that tell me like, I'm never getting off this because I'm like, no, you can't take it forever.
So
But
it's something you still cycle.
still, I can cycle. There are times when I've had patients on it for almost 6 to 8 months because they have such a severe
Really?
infection. There's another one. I say the two top. though, Natalie, be Malia, which is neem. Neem is always thought about just like spraying plants to help kill off mold, but neem, it's an Ayurvedic herb.
Okay.
Neem, it is beautiful for killing off all infections. So, in my opinion, I would say search for the bladder infection, if
Okay. And how
UTI.
do you search for it?
That's why I get a Euro key. So I would tell everybody
Okay.
out there, there's a test called Euro, like urinalysis, Euro key by Microgen DX, and then
Can anyone get that or do they get that from
yeah.
okay.
They can get their doctors, but they need like I don't know if that now, I think they changed it where like most people can just order it, but they may have to have
Okay.
like a physician's, maybe. Most of my people have been able to call and get it, maybe because they know me,
Yep.
but it's one of those labs down in Lubbock, Texas, I believe.
Okay.
Really impressed. And so if the thyroid gets low and it's working not at 100%, they'll have the
Uh-huh.
night sweats. And then I say this, like just like you were talking about, liver congestion, even if it's normal, always make sure you know your liver levels, like your methylation.
Yep.
I'm all about that. I'm all about doing gene testing for MTHFR.
Yep.
And in Chinese medicine, I just clean out the liver. So if you're going to go, you're in menopause, go to the Chinese medicine practitioner and say, I need my kidneys, my liver, and my triple warmer cleaned out. And those three, I'm telling you, have made tremendous steps for my patients. And I mean, the first patient I treated though, Natalie, was like my mom. She was going through. She's like, and she's a little Korean lady. She's like, I'm
Yeah.
sweating. And I was like, oh man. And then I found such bad bladder infections in her. And we started using herbs and stuff, like the ones we mentioned, we cleaned it up. And she's like, they call it upsa. Upsa means there's no more. I was like, Mom, how they? She goes, upsa, no more. And that was like in a
Wow.
few weeks.
Wait, this is huge because I'm having lots of aha moments right now because one of the very common things I see in menopause with women in my communities is literally everything you listed: lower back pain, low
Mhm.
thyroid, liver numbers. So now I'm like, wait a minute. Wait a minute. Have we been missing this whole step here? Because
That's-
we're thinking we all know what a UTI is, but we're waiting until you have to pee every 5 seconds or you're in pain or there's like, right?
Yep.
But I had no idea that there could be these underlying smaller infections that are linked to all of that. And if I'm hearing you correctly, all those things that we're thinking are just part of menopause, like the low thyroid, the back pain, the liver congestion, actually could be the cause of the symptoms we're feeling.
Yes.
This is like mind-boggling right now.
And it is nothing like all the Chinese medicine practitioners listening today. They're like, oh yeah, yeah, that's it. But
Like
I
this
would
is
say
easy
this
to them, but to
to
us, we're
them.
like, what?
Truly, to me, when I found out though that we talked about like, UTIs, or you don't want to wait, because that's exactly right. Your body's so good and intelligent at keeping all the pain signals as low as it can throughout your life. It'll push it off. It'll push away in your brain. But then, like you said, I'm peeing all the time because these ladies in menopause are like, I have to
Uh-huh.
pee like and I'm
Yeah.
like, there's an infection. No, I got a test. No, there's an infection. It's just they're not testing for the right proteins of the infections. And when you start really investigating, and that's why I've been wanting my membership and my website, trying to get in touch more and more with these labs. I use them to really
Yeah.
just have like a good system of just testing. But you're right. This is, in my opinion, I've seen with every person that's come in with menopause, and the low thyroid. And I want to explain this to everybody. When your body, just imagine this. It sounds really woo woo, but remember they talk about going out and grounding. It's because
Okay.
Chinese medicine, the
Which,
first
by the way, grounding means barefoot on grass for
barefoot on
okay.
grass, you're getting the earth ions, you're
Hmm.
exchanging net positive, like exchanging toxins basically.
Okay.
But the biggest point of that is that in your feet, if you guys can imagine, the ball of your feet, there's one point, it's called a kidney one. And what happens is your body draws a lot of chi, a lot of electric ions up through your feet, up to your kidneys. And this is the point. The kidneys act like batteries, like literally battery packs. If you have an infection in the kidneys or the urinary bladder system, it will make your kidneys very weak. And the point of it is, it has to shoot that energy into your spine, into your bones, right at L2, L3. That's why everybody has a kidney and bladder infection will have tight hip
Yep.
flexors, tight low back at L2, L3. If you watch
Okay.
every
I'm
lady that
convinced
has
that
it,
maybe I'm convinced I have this problem
I'm
right now,
telling
by
you,
the
like
way.
I have tight hip flexors. I can never get them stretched.
Yeah.
Why? Because at L2, lumbar 2, the kidneys sit, the electricity's trying to get up to them. They're sick or they're infected,
Whoa.
and it turns off the nerves in that part of the spine, and you're like, God, I can't even stretch my hip flexors anymore. And you can do all the stretching in the world you want. You do all the exercise, you're not going to get them undone. And then the kicker is the chi goes into your spine, your vertebra, your bones, and goes up and down your spine. So but that helps two things in
Mhm.
menopause. Healthy kidneys produce erythropoietin hormone, which signals to your bone marrow to create red blood cells. So you have healthy bone marrow. And it actually will help strengthen bones. Kidneys always associated with bones in Chinese medicine. So you have weak kidneys, you have weak bones. So you have
Wow.
osteoporosis, and your bones will make you do what? You'll have cold bones. So you have everybody, they're like, my hands, my feet are super chilly.
Uh-huh.
Why? Because the kidneys are weak and they help you produce more red blood cells in your bone marrow. So if you have stronger kidneys, you'll have warmer blood flow. And I'm telling you, like you turn on the kidneys and that chi goes up and stop being stuck at the kidneys. It'll go up into the throat. It'll jump into the thyroid and the thyroid will be happy and you're gonna be like, oh, I have more energy. This is gonna be
Wait,
great.
are you guys connecting the dots here like I am, or am I don't know if I'm the only one having aha moments here, but like because I think we've all heard the friend that went to acupuncture and they're like, "Oh, acupuncture fixed my," and we didn't understand. But I'm starting to understand what you're saying now. It's going to the root, and undoing the kink and looking at the thing that we haven't been looking at. And I'll tell you, like, this might be why some people with their low thyroid are saying, but they're taking thyroid medication, but it's not changing anything because we haven't actually fixed the problem.
That's right, because the thyroid, I mean, my mom had hyperthyroid. The reason her thyroid got worn out was because her kidney chi or kidney was so fatigued from infections, or her bladder was, it wasn't allowing the energy to get up into the fire element, like basically into the heart. And metabolically too, in Western medicine, if you have an infection that's low lying and you not finding it, right?
Yep.
What your body do? It'll go into a fight or flight kind of situation, and your thyroid hormone will be producing thyroid hormone consistently all the time to tell
Right.
your body to go fight something. But you're like, the body knows it's like it's in the bladder, and it's down in the bladder. And but consciously, we're not thinking that we know what it is. It's like we don't even know we're in fight or flight.
No.
It's like my thyroid's screwed up. It's like this is where you and I talk about investigation. Why would the thyroid be off? Because it's pumping up harder. It's trying to tell your cells produce energy because I don't have energy. So
Right.
it's trying to get it. So I'm getting a little bit too excited.
No,
But
no, this is good. This
but
makes
the
sense because,
thyroid,
but
yeah.
then this is making sense why when you just add like T3 or you're adding something, you might not feel optimal because you really haven't fixed the problem. You're just adding more and it's just like a temporary band-aid and it's just making you feel not, it's not helping.
It's not helping because it's basically giving you excess extra T3, which I think is valid, and people
Right.
take it. It's great, and your cells love it. They're craving it, but it's because why? It's like your thyroid's worn out. Like it's tired. Like I always say, you have to think
Yeah.
you have to give it some love. But remember, you talked about so well. You said when I got sick, I looked at my gut health, and that's why I was so adamant about it. It's because you and I, if we have hidden infections in our gut, in our urinary system, in our lungs, in our
Yep.
thyroid, and we work at it to clean them, like your friend, Natalie, your friend's telling you, like cleanse it
Yeah.
out. Those individuals always have such a better time with their hormonal shifts because they cleaned out and they took their body out of fight or flight. That's why I love just doing, I'm not saying do a cleanse every day. I am saying like really investigate and find out, like if you have little symptoms and you're thinking, what symptoms? Like I'm peeing every night. That's not normal. You've got to get that situation.
No, but we're hearing that's because of lack of estrogen and vaginal wall thinning. And that's what we've been told why we're peeing all the time.
Yep, there's some I agree. There's some things that would say yes, that's what happened. So I'm not knocking that. I
Hmm.
think that does have a big issue. But to me, why your body would keep pushing urine out is because there's infection hiding up in your kidneys. It's like I don't want this here anymore. That's my opinion. And
This
I've
makes total sense.
and you know as well as I do, like we believe in like innate intelligence, and I'm like I've seen it, and not being cocky, I'm just saying in my patients. I mean, I think 20 something, man, it's been a long time. Wow. But when over the years, you see that people, when you start cleaning them out, they will tell you the small hints. They're like, you know what? When I got rid of that kidney infection, I stopped urinating and stuff, like hardly did that.
Yep.
I stopped being so fearful. Like little things they pick up on in themselves because the kidney weakness means that they're fearful. They don't mean to be. They just feel like either they fearful they don't belong, they're fearful that
Yeah.
they stick out, they're not in their group. Those little signs, guys, in menopause. I'm telling you, you think they're just little signs. Oh, this is just normal. Yes, there's a healthy way to do it, but I'm not saying I know every way, but this is my angle at it. Yeah.
This is so bizarre to me because like everything you're saying here, connecting the dots is the stuff that goes along with menopause. And it's like, I don't feel that this is talked about. This is really wild. Like what we've heard is the opposite. Like, okay, you're in menopause. So now your thyroid's low and you're going to have back pain. You're going to feel more inflammation and you're going to have liver congestion and you're going to have tight hip flexors and you're going to have like all this stuff. And you just like flipped it all the way around. And you're like, no, all these things are making you feel this way. This is
Yeah,
wild.
I mean, it's like it's a different paradigm to think about it that way. But I always say, like with my patients, like let's go from both angles. Yes, the estrogens can do this, and we can go
Yep.
to that, but let's clean up. And I'm thankful. I'm just saying, I have seen people that have had to reduce their estrogens and reduce things because they got these areas cleaned out. And it's really, really cool though. I'm not
Yeah.
saying I can
But
answer
I get
everything
what
with
you're saying.
schools.
You're not saying you can't do hormone replacement or any of that. You're
No,
saying you
no, not
can,
at
but
all.
why would you not want to just have everything work optimally? So like this makes sense.
Yeah.
This doesn't hurt it. So okay, so this what you just said, is this like standard practice for somebody that is an acupuncturist or Chinese medicine, or is this like your unique thing? Like, is this, because I'm like hearing this for the first time, is this your Dr. Chris Motley's unique thing, or is this like a standard thing that we're just been missing?
I think that every Chinese medicine practitioner and every, like maybe frequency medicine type individual probably has a grasp on it. I mean, I can't speak for everybody. I will say though, Chinese medicine practitioners, some of them I've seen that are really great with like, fertility.
Yeah,
Chinese
I've
medicine
heard that.
practitioners are really good because they know a lot about hormones. I'm not saying that they think it the same way I do. I think a lot of them probably do. I just think personally, like, I'm just a big patterns guy. Like, I hope that's not sound, I don't know if that's unique to me, but that's how I think about it. But I say most Chinese medicine practitioners, most all of them would automatically know kidney weakness, weak triple warmer. They know that totally know that
Okay.
those
What
things.
does that mean, triple warmer?
Oh man, triple warmer is the three gates. And what Chinese medicine would say is like when the kidneys hold the electricity, right?
Okay.
They shoot into your spine, you have three gates that qi goes through. Three. So usually it's like upper, which is like the heart, the
Yep.
lungs, right here, and you'll have the stomach, which is your digestion and your food and your adrenals,
Okay.
like right there, and your lower, which is your testes, your ovaries. And those are the three gates. So what they're saying is you want a lot of strong kidney qi so that you have a healthy heart and lungs, you have healthy digestion, and you have healthy sex. Those are the three ways. Like, and so
Got it.
that's why, watch this. Now, ask all your patients this. On their wrist, it's called triple warmer 5. And it's like
Okay.
little bones right here, like right in the middle. And you don't have to, but I'm saying, ask them, do you ever get sore wrist or like carpal tunnel?
Uh-huh.
You watch.
A
A
lot of
lot
them
of them
do.
have
Yeah.
sore wrist. They can, like when I do a push up or when I do, I was like, my wrist
Yep.
hurt. Triple warmer. I'm telling you. And that meridian
Whoa.
goes up the arm and into the neck, right by the thyroid. So, I mean, it's a
Wow.
lot to take in.
No, this is
I'm
good.
sorry, Nat.
You said something else that that you popped over and you said, and I picked up on it. You said frequency medicine. What does that mean? And is that like,
Um,
because homeopathy would say frequency medicine. Is there parallels there?
Yes, yeah, I use at the office. I use tons of homeopathic, and I use Des Bio. Shout out to Des Bio. They're a great brand, great company. They have a
Okay.
really good brand. But I use a small biofeedback device. I was taught by my mentor, Dr. Doughty. He's out in Wichita, Kansas. But he created a biofeedback device that allows me to like literally scan for frequencies. And
Okay, well, tell me what that means. Tell us what that means in English.
if the
Because,
body is the electricity that's running through our bodies, right? So you guys just imagine this. Close your eyes, picture this, but you have electricity running through your body, and it's like wiring in your house, and all
okay.
the electricity is flowing. It's good, but it emits a wave, and so it's a bio wave. It's like literally a biofield around your body. So you do have like an
Hmm.
aura. Some people say it's an aura. Some people say it's like a realm
Yep.
around you. So there are some individuals, and there are certain devices that can measure the frequency output coming from your body. That's what they are.
Okay.
And there's a lot of them out there. There's a lot in Europe.
No, like I use a sleep one, something for my sleep. I use like the Soul Tech for my sleep. That does that.
Yes,
So
yeah.
okay, so that's all.
There's
But I
devices
hear
like
frequency. I don't fully understand it yet.
totally. And now what we do is like we just measure the frequencies and measure if the frequency coming off an organ's sick. And then we
Okay.
find the homeopathic that actually can absorb the sickness out of the person, basically. And it works really
So
cool.
homeopathy and acupuncture are kind of complementary, I would imagine
I
then.
think
Is
they
that
are totally. Yeah,
they
I
are?
use it.
Okay.
Yeah.
So
Mhm.
most acupuncturists, they understand or they learn homeopathy too. Is that accurate?
Not all of
Okay.
them. No,
Not
no,
all of
no,
them.
no. I'm just a nerd.
Okay.
Yeah, I try to go learn more, but yeah, but not all of them though.
Okay. So when you say frequency medicine, you mean you're testing the frequency on specific things and then matching that frequency to heal it? Did I say
That's
that right?
exactly right. Because we have devices that can measure. Remember, I told you the points and such. You can
Hmm.
measure the frequency of those points, and then you can then match it up to a homeopathy therapy, like, and you can find out which one would cure that blockage or that frequency. Yes.
Wow. Okay. So typical woman comes to you with aging symptoms. So
Hmm.
I'm not talking perimenopause, menopause, postmenopause. They're all the things. Like they're like, I'm foggy headed. I'm not sleeping. I'm hot flashes. I'm sweating. I'm hot. I'm cold. Now I'm telling my thyroid. So what's your process? Like, how do you work with somebody? Or what's the process there?
Okay, I'll try to. And Natalie, seriously, stop because I don't want to get like too nerdy and get lose a listener. I
Yep.
know how it is. I get first thing I do is when they tell me they sweat off and on and they have brain fog, the first thing I
Yep.
usually go after is their constipation if they are, their poop, or
Okay.
like I go check their colon and their liver, the first two things.
Got it.
And then I find out if there's any infections that I believe that are in there. We start working on that because naturally when you clean out the liver and colon, their liver's methylation, right? Their
Right.
methylation process works better. Their cholesterol and their hormones start to get eased up. They start to feel better. And
Okay.
that then I go to the kidneys. I find out if the kidneys are sick. So right off the bat, when they're saying I'm sweating all the time, my brain fog, the reason their brain fog is usually coming up is because congested liver and congested colon and kidneys means congested lymph flow, and they're going to have sudden infection up in their head. So
Okay.
those three organs I clear up, then I check their sinuses in their head. I ask them if
Yep.
they had strep, staph, mono, anything in the past. And they'll say, oh, I had it when I was a kid and I don't think I have anymore. It's like, no, if you never really try to clean it out, it's still there and it's pooping in your brain. And that's why you get brain fog. And
Wow.
so you have to clean out those organs to allow the body to go tell the rest of the body, go, hey, it's open. I can drain.
Mm-hmm.
And when
Mm-hmm.
you clean it out, they start draining their sinuses. I do a lot of spinal work along the points that are associated with the organs,
Yep.
get them pooping, whether it's using the magnesium we talked about, using magnesium, using good herbals to help clean that out. But when you get them to flush, that's the first step. And I hope that's not too much, guys.
No, that's good.
But I always say, I'm not telling everybody out there to go get, a whole bunch of liver, decongested. What I am saying is really look at the herbs to help clean out the liver and clean out the kidneys and then really be really soft and gentle with it. And then after that, that's when I start doing some testing for like different nutrients like that they may need, like minerals and vitamins. That's how I approach it. And it really does sell out pretty well because after a while, Natalie, they start cleaning up all their toxins and they'll be like, you know what, after I got rid of that such and such, this part naturally came back, like this healing. I don't sweat as much.
Right.
Like I don't have much brain fog. And so it's because now the body's energy is able to do what it wants to do, which is really amazing. Yeah.
Well,
But-
my mind is like completely blown. I feel like I'm like, how have I been on this planet 53 years and I never looked at this or understood it? And it's not that I haven't seen practitioners this. I just never, nobody's ever explained it to me like this. This is
Oh,
making so much sense.
oh, I'm telling you, I can't take any credit. I learned from mentors like Dr. Michael Leibowitz. He's out of Hawaii. And they were always adamant when they used to tell us about hormones, because, they're like, they
Yeah.
invested in their heart because they've had a lot of patients. They said, you just got to make sure that the doctors who do hormone therapy do their best, that they're going to, but we can help by like cleaning out the
Yeah.
system. And that really is, I mean, I'm thankful. I've seen a lot of people go to a lot of,
Totally.
healing of the thyroid and the ovaries.
So what's your, and I'm asking your opinion now, not, and I know your tendency will probably be to be like not offending anyone or not like you're being very like nice, like everyone has a place with what they teach. But I've featured a lot of doctors on here that are very specific about hormone replacement. I've also featured a lot of experts very specific about thyroid replacement. What do you want my listeners to know
Mhm.
about this approach, what you're talking about? And I want your opinion. Like, do you think we jumped the gun too early with traditional thyroid and hormone treatments? Like, do you like, I'm just really curious where you're training, like what your thought process is around all
Truly,
that.
truly. And you're right. I don't want to offend anybody. The doctors out there, they have their thoughts and they could disagree. I, I,
I'm
I,
giving you a pass there. No one's
yeah,
gonna be offended.
totally.
I just really want your opinion. Like, what would
I,
you?
I'm with okay. One aspect is this, okay, but I'm going to preface this with this: is that when you get to a point where
Mhm.
the blood work's already showing it, then
Yep.
we know you've gone really far, like with
Okay.
in that condition. So I have to keep that in mind. But I do believe that we do jump the gun in some ways when we do get these hormone
Hmm.
levels that are off. And I wish that we would investigate minor infections, minor
Okay.
bacterial infections, minor viral infections in the body and go after those and clean those up. That's my opinion. I think we
First.
do go first because you and I know this, that remember, guys, the hormone systems is only reacting to trying to help your body adapt to something going
Right.
on internally. And I'm with you. I think it's, for instance, I've found like there's one called cytomegalovirus. You've heard of it before. Coxsackie virus, hand, foot, mouth. Those don't naturally go away and they'll go into certain organs and they'll make those organs sick. You
Yeah.
need to flush it out. And I just want everybody out there to listen is this, that I do believe that if you do have this going on, it's like find like a Chinese medicine practitioner, a good, kinesiologist, muscle tester, somebody
Yep.
that can go and investigate and work with your doctor to find out. But I'm with you.
Okay.
I think we do jump the gun, honestly. And
Yeah.
I think we've pushed aside good herbals that could clean up a lot of infections. Because as well as I do, there's some docs out there that will say stuff like, "Oh, there's no, people don't have parasites," and I'm like, Yeah, I get pictures of poop every single day, literally.
Right.
And I'm telling you, Natalie, I mean, like literally, I'm so used to it. They're like, Doc, does this look like a worm? I'm like, that's a worm. And I'm like,
Yeah.
yeah. But anyway, that's my answer though.
Yeah, that's wild. God, this is so fascinating here. Okay, y'all. Okay, so Dr. Chris Motley, he's got tell us about your podcast a little bit. How would you, I mean, it's so good. I mean, how would you describe who is your
Oh,
podcast for? Is it for
podcast
everyone? Is
is,
it for,
yes, I always say this, it's for everyone. And I just think it's
it's
for the
ancient health, by the way, you all.
Ancient Health Podcast, and I just try to make it, I want a simple, easy format that just gives people that felt lost about health. I
Uh-huh.
want to give these alternative thoughts and processes for you, like the mother of three that doesn't know what to do when they go to the doctor. That's always my passion. So it's like I want men and women to be able to go in and say, okay, use ancient health, like use ancient herbs, some mineral supplements to
Yeah.
help them along, and then give them things about their emotions. So we talk about emotions and
Okay.
how that programming can set your organs up to be not so healthy, sick, but what can we do to help bring them back? That's the whole thing of
Makes
Ancient
sense.
Cast.
Yeah.
So
Yeah.
yeah.
Super informative. I like how you break things down simple and it's very helpful. Like you're the first one who's really got me looking at this different. Like I just literally never understood it before. Where do you want people to go find you other than obviously your podcast, but where else are you most active? Where do you want them? How can they find and work more with you?
Okay, Ancient Health Podcast, but it's also Dr. Motley. It's all spelled out. Dr. Motley spelled out because I couldn't get Dr. Motley. But you can go, but now I got the website. You can go to drmotley.com.
Great.
We got a new website up, which is great. I'm going to make it easier and simpler. At Dr. Motley on all the platforms, Facebook and Instagram. I do a lot on TikTok, doing more, and that's where you can find me. And if that's where I'm at, and if you guys like the info, just let me know, and hopefully I'll keep putting it out there.
And what I love about you is you're not like, this is the only way. You're very much the whole approach. You're like, there's a lot of different things we can look at, a lot of different ways, or a lot of different modalities. And you want people to consider this as like, as the way to get the kink out. But you're not saying this is the only way.
No, no, I could go through a story. I had a ruptured ulcer when I was 2017, and modern medicine saved my life. So I'm not going to go and say you don't get a painkiller or get like surgery.
No.
I mean, no, I needed it, and I'm thankful I had it. So I just want people to know that there are possibilities, like you and I were talking about investigating, that there are other things that could contribute to a diseased organ. And in the
Yeah.
mainstream, most of the time they're not going to discuss it because they just
No.
dismiss it. So that's my goal, is to just inform them like, hey, you can use both. Like, and I know we got to sign off here, but I'll just say this. I know like antibiotics can be not so helpful with the gut and such, but I know you've seen it too. I've had some patients that
Yeah.
come in and they had a really bad infection in the lungs, and I found it and I was like, and one time I had a patient, she had such bad lung issues, she kept having heart rate issues. But on my Chinese medicine practice, I said, something's in your lungs because
Yeah.
the pathway keeps getting deficient. And so her whole family had rheumatoid arthritis, everybody in her family, right? This is a kicker. And
Yep.
then finally, she almost went to the hospital because she kept having this lung stuff. I said, you need to go get it checked. A great doctor finally took her to the center disease, doctor,
Hmm.
and found out that her lungs was filled with fungus, like this really weird fungus. And she came to me and she was like, oh, Dr. Motley, like they want me to take an antifungal, and they showed me the x-ray, and I was like, you need to take the antifungal. Like,
Yeah.
no, like they put her on for a year. And some people say, I wouldn't do that. I'm like, as bad as it was, when she started taking that, her heart rate went right back to normal after 40 something years. And then her rheumatoid stuff started to go away.
That's wild.
And I'm just saying, always investigate, always find doctors good to work with other doctors. That's all my goal is.
So good. Thank you so much for being here today. This was
Oh,
super
Natalie,
helpful.
you're so sweet. Thank you so much, everybody. Thanks so much.